Hello, uh, I, student Nas Abdul Majid Ibrahim. Our topic for discussion today is gestational diabetes. But before we go further, I would like to recap back on what is diabetes itself. Uh, Diabetes is a chronic metabolic disorder related to increased glucose level within the bloodstream. So, in fact, this is diabetes. We have several types of diabetes. We have type 1 diabetes, we have type 2 diabetes, and we have gestational diabetes itself. So, our topic for discussion, as I mentioned, is gestational diabetes. So, what is gestational diabetes? Gestational diabetes is the types of diabetes result at gestational period of a pregnant mother, which leads to infant pancreas functions. This is and what is the cause? The causes for gestational diabetes number one is genetic factors, hereditary track. This is what I mean. Number two, we have drugs like corticosteroids, which is betamethasone, dexamethasone, prednisolone, and we have thiazide diuretics. So apart of that, and next we have virus affecting the pancreas. These are the causes of diabetes. So after the causes of diabetes, let's go to the complications of diabetes. Complication of diabetes. Number one, we have hyper or hypoglycemia. We have diabetics neuropathy. What is diabetes neuropathy? Diabetes neuropathy is a condition where nerves are damaged by hyperglycemia. What I mean is, uh, increase in glucose level lead to damage of nerves. We have diabetic retinopathy. What is diabetes retinopathy? Diabetes retinopathy is a condition where retina of the eye is being damaged by what? By glucose, hyperglucose level within the bloodstream. Apart of that, we have diabetes gangrene. Apart of diabetes gangrene, we have foot sore. Apart of foot sore, and last we have amputation. So, how do we prevent ourselves toward diabetes? Number one is by knowing our health status by medical checkup. We are going for medical checkups into hospitals to know our health status. And if we know we are the carrier or we have history of foreparent with diabetes, it is good to know our health status. Number three, avoid taking something which will damage our pancreas. As we know, pancreas is the portion where insulin is being produced in the body, which is very important in uh, in glucose tolerance towards cells. This is, I would say, by with just small and tiny presentations.